Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is 3klpm@gmail.com. Today we are going to talk about a very interesting topic, head thrust test and vestibulo-ocular reflexes. Cranial nerves part 57, vestibulo-cochlear nerve, that is 8th nerve part 7. So head thrust test and vestibulo-ocular reflexes. But what are these vestibulo-ocular reflexes? VOR. The vestibulo-ocular reflexes VOR serves to move the eyes at an equal velocity but in the direction opposite to the head movement. So vestibulo-ocular reflexes VOR serves to move the eyes at an equal velocity but in the direction opposite to a head movement. This keeps the eyes still in space and maintains visual fixation while the head is in motion. There are several ways to examine the vestibulo-ocular reflex, including the doll's eye test, head thrust test, dynamic visual acuity and calorics. There are several ways to examine the VOR, including the doll's eye test, head thrust test, dynamic visual acuity and calorics. Now we shall see one by one. The oculocephalic reflex or the doll's eye test. The oculocephalic response is primarily useful in the evaluation of comatose patients. Turning the head in one direction causes the eyes to turn in the opposite direction. This response indicates that the pathways connecting the vestibular nuclei in the medulla to the extraocular nuclei in the pons and midbrain are functioning and that the brainstem is intact. However, in an alert patient, the visuomotor and ocular fixation mechanisms come into play, limiting the drawing of any conclusions about vestibular functions. So basically, oculocephalic reflex or doll's eye test is done in a comatose patient to check the integrity of brainstem. It may not be of use in an alert patient because visuomotor and ocular fixation mechanisms come into play, limiting the drawing of any conclusion about vestibular function. Head thrust test, very interesting, very fascinating. The doll's eye test utilizes slow side-to-side head movements in a comatose patient, whereas the head thrust test is done in an awake patient. A very important difference between head thrust test and the doll's eye test. The doll's eye test utilizes slow side-to-head movements in a comatose patient, whereas the head thrust test is done in an awake patient. Abrupt, rapid movements are made in each direction while the patient attempts to maintain fixation straight ahead as on the examiner's nose. The ocular smooth pursuit mechanisms cannot compensate for head movements done at such high speed velocity, but normally the VOR will maintain fixation and the eyes will hold on target. When the VOR is impaired, the compensatory eye movement velocity is less than the head movement velocity. The eyes lag behind the head movement and a corrective catch-up circuit must be made to resume fixation in the eccentric position. If we see this diagram, the head thrust test can be better understood. So this is a diagram depicting the head thrust test with the defective left labyrinth. The normal patient maintains fixation throughout. The patient with the defective left labyrinth loses fixation with the rapid head movement and must make a catch-up circuit to the right. So in the top diagram you can see the normal, and in the bottom diagram you see the defective left labyrinth. So normally in the top diagram, if you see, there's a fixation, and when we turn the head to one side, still the eyes maintain on the exact point the fixation is maintained, and therefore there is no corrective circuit. Whereas persons in the bottom diagram, if we see, there is a defective left labyrinth. So eyes are fixated normally, but when the head is shifted, The eyes also goes along with the head, and therefore the patient has to make a corrective catch-up circuit to the right. So this is the head thrust test with a defective labyrinth. The next what we are going to see is the dynamic visual acuity. What is dynamic visual acuity? The ability of the vestibulo-ocular reflex to maintain ocular fixation means that a patient can read even while shaking the head to and fro. The dynamic visual acuity test is performed by obtaining a baseline acuity and then determining the acuity during rapid head shaking. Degradation by more than 3 lines on the Snellen's chart suggests impaired vestibular function. Oscillopsia, a visual illusion of the environmental motion causing jiggling while walking or in a car and difficulty reading signs while in motion, symptomatic corollary of impaired dynamic visual acuity. So these are all the interesting, fascinating concepts of the vestibulo-ocular reflexes, especially the head thrust impulse test. I hope you have enjoyed listening to my concepts on the vestibulo-ocular reflexes, including the head thrust impulse test. The other important concepts of neurology I put in a question and answer format in a book, Focused Neurology, written by me, Dr.Sreenivas. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be bought online. I hope you have enjoyed listening to my video on the oculovestibular reflexes. If you have enjoyed it, please like and share the link. But please subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.